Hello, dear friends. Well, we meet again in the summer. My name is Sofya Dorinskaya. I am a doctor, head of the Medical Information Center. In this center, using my own method, mine and the authors, we conduct testing to identify nutritional deficiencies and help eliminate them. And today, my video will be about a vitamin A metabolite, about vitamin A itself, and about the problem that people are trying to solve. Instead of giving people vitamin A, they give its metabolite, that is, the substance into which vitamin A is converted in the human body, and what problems arise because of this. So, today we will talk about the substance isotretinoin. This is a metabolite of vitamin A. Here is retinol, another name for vitamin A. And this substance, according to our data, here is a person who came to us. This substance is prescribed for skin problems, including serious skin eruptions, purulent breakouts. A lot of people suffer from these, especially during puberty. Girls, teenagers, young people, teenagers, this problem is really acute for them. Let me explain today in simple terms what the essence of the problem is. Right here we have the outer surface of the human skin, and there is a sebaceous gland there. I won't draw it completely anatomically. For example, here is a vellus hair, and next to it is a sebaceous gland. And the sebaceous gland duct becomes clogged. The secretion accumulates here. This secretion starts to become inflamed. Naturally, swelling appears on the surface of the skin. You can see purulent, that is, pus-filled contents here. And people either squeeze these pimples or they go for cleanings. The problem is that this situation itself looks unattractive. And after these purulent contents are removed, scars remain. Sometimes there are literally boils on the face, and everything revolves around this. The problem is that a person's excretory duct becomes clogged of this very sebaceous gland. But what is the problem? What is the main problem? The duct itself, as you can imagine, is lined with epithelium. Now, if you have been consistently watching my educational videos for quite a while now, then you likely already know the answer very well. Which specific vitamin deficiency is it that leads to the increased shedding of the skin's epithelium? That is exactly right. It is a chronic vitamin A deficiency. And the whole issue with purulent skin problems is a vitamin A deficiency, which causes increased shedding of the epithelium inside the gland. It clogs the duct, and the secretion can't come out freely and perform its barrier function because it's not there for nothing either. These glands on the surface of the skin also exist for a reason. They perform a barrier function, a protective function, helping the skin resist external influences. So, with a vitamin A deficiency, the epithelium sheds, clogs the duct, inflammation develops here, and then everything else follows. If anyone has ever had acne, you know very well how the story goes from there. So, there are several methods, and one of them is absolutely hellish. This is, for example, prescribing contraceptives to girls during puberty. This is simply killing a person, you understand? This just destroys a person's hormonal balance right from the start, at the stage when their hormonal status is still forming. But in this case, we found that people are also being prescribed isotretinoin. When we started to find out what this substance is, it turned out to be a metabolite of vitamin A, and immediately the question arose, why prescribe a metabolite? The side effects of this substance drew a lot of attention. For example, dermatological reactions, dry mucous membranes, skin rash, dermatitis, itching, cheilitis, inflammation of the tongue, erythema, especially on the face, sweating, palmoplantar peeling, paronychia, which is suppuration of the fingers, nail dystrophy, hair thinning, acne, conjunctivitis, photophobia, decreased night vision, corneal opacity, hearing loss. From the central nervous system and peripheral nervous system, headache, depression, seizures, suicidal tendencies, in isolated cases, intracranial hypertension. From the digestive system, nausea, colitis, gastrointestinal bleeding, transient increase in hepatic transaminase activity due to liver cell destruction, in rare cases, hepatitis. The hematopoietic system is affected, anemia. Glucose, that is, changes in glucose levels occur. Muscular system, osteoporosis, nosebleed. In general, you read this and you're amazed. But in reality, what happened? Instead of giving a person vitamin A, when the body knows perfectly well what to do with it, the body will easily obtain all the necessary metabolites from the vitamin A it receives from outside. The body knows perfectly well how to regulate vitamin A metabolites. And never, never, under any circumstances, does taking vitamin A itself lead to these kinds of consequences. Never. But a vitamin A metabolite, when it is taken, essentially bypassing the body's natural process of converting vitamin A, is an unnatural substance for the body. And so we see some very serious side effects from taking this substance. I see a very interesting system here, a very interesting approach. In fact, I'm not the first, nor will I be the last, and the people who watch our channel, Evidence-Based Medicine, know that doctors all over the world, honest doctors, are sounding the alarm that medicine, it has been distorted and changed under the pressure of pharmaceutical companies. And now any painful condition, any state that bothers a person is now seen as a situation from which some profit should be extracted. In cases where a person simply needs to be given a vitamin and in a sufficient amount, which would simply lead to a complete resolution of the problem. Instead, people are given a vitamin metabolite or some other substance which, as has already been shown in experiments and is written in the instructions, leads to even bigger problems that will then need to be treated. That's how they make an elephant out of a fly. Do you understand? And of course, if you then start developing osteoporosis or hearing loss as well, I'm reading here, yes, maybe nail dystrophy, muscle pain, anemia, neutropenia, which is already a change in the blood, then naturally you start taking other medications, and that's when this whole cycle begins to spiral. If you have this kind of problem with pimples, to put it bluntly, even serious ones like boils, for example, this is a sign of a vitamin deficiency. I highly recommend that you take increased doses of the vitamin directly. And that's exactly how it's sold in stores. Vitamin A or retinol, increased doses of 40,000 IU or 50,000 IU per day. And add provitamin A to this as well. Combine vitamin A and provitamin A. Also in slightly increased doses, because when you have a deficiency, when a person has a deficiency, they need higher doses, since the body is already showing that it lacks them. And I can tell you what you will achieve. Even if your skin is in relatively good condition, you might consider incorporating these higher doses of vitamin A, combined with provitamin A or naturally occurring beta-carotene. After some time, if you are a woman, you will see that you can go without foundation. Your face will look photoshopped, but it will just be your natural skin. And you won't need to use foundation every day. Furthermore, if you truly want to know more about how vitamin A works, how beneficial it can be for the human body, and what serious health complications can arise from a vitamin A deficiency, right? You can order or purchase. This is a bookmark. You can place an order. These wonderful books by Professors Lepsky, in which each one describes the symptoms, causes, mechanisms of development, and how to detect vitamin A deficiency. For children, please refer to the introduction to the clinic in this book. In other words, you can study the topic thoroughly on your own. The books are written in fairly simple language, but of course, you need to be able to work with the text if you come across any terms or words you don't understand. That is, you should realize that you need to look up these words in a dictionary. And if within the dictionary definition you encounter a word you don't understand inside the article, then you also need to figure out what is being discussed there. So basically, there's nothing supernatural here, nothing written in some overly complicated or confusing language where you can't tell what it's about. There's nothing like that here. No, these are Soviet professors, old Soviet professors whose goal was to teach. Their goal was to pass on knowledge. That's why these are invaluable books. I also want to remind you that when our channel reaches 500,000 subscribers, we will hold a giveaway among our subscribers. 3 sets of these books. They will be sent free of charge to the winners anywhere in the world. And in this way, we will celebrate reaching 500,000 subscribers. I also want to invite you to join our evidence-based medicine groups. These groups exist on all social networks. They are on Odnoklassniki, Vkontakte, and Facebook. There is no silly or intrusive information in these groups. Posts are made about once a day. Moreover, these posts are meaningful and descriptive. I also publish quotes there. That is, several times a week I post quotes from these books. These quotes are complete thoughts that you can read, immediately understand something, or even apply in practice. So, I select quotes from these books. So please subscribe to our groups. You can also ask questions there. Of course, the main channel of communication for those who have questions specifically for me personally, the main channel of communication, it's the website Dorinskaya.com. You will always find a link to this site in the description box under the video. Because under every video I get the question, how can I contact you? My friends, there are always links in the box under the video to all the resources where you can find me. It's so simple to the point that you can even, I don't know, just if you type Sofya Dorinskaya into Yandex or Google, you'll find the website and you can always write to me. Thank you for your attention. I hope this video was helpful, especially if you have this problem. Use this advice and stay healthy. Thank you for your attention.